We're going to take you to a live event that's happening in Columbus. The governor of Ohio, Governor Mike DeWine, talking about the Social Media Parental Notification Act. This would make certain social media companies get verifiable parent permission before anyone under the age of 16 could be on social media. Let's take you live to Columbus.
Legislature, we have put, as you know, a great deal of emphasis on mental health. Our first two executive orders were to create Recovery Ohio to address the crisis of mental health and substance use disorders, and also our Children's Initiative to coordinate programs to give children the best possible start in life. Just to mention a few things that I want to thank the legislature for doing and working with us on. Number one, we launched Ohio Rise. All of these, of course, have to do with mental health, which is our topic today. We launched Ohio Rise. Under Ohio Rise, children who have multiple medical and complex behavioral health challenges are now getting the help they need in their own communities. Parents are no longer being forced to give up custody of their children to get them the help that they need, and families are now staying together. Number two, we create our Student Wellness and Success Program, again with the help of the legislature in the first budget, the second budget, and now in our third budget that we've submitted to the legislature as well. The purpose is to address the mental and physical health needs of children right in their own school buildings. Schools have used that funding to create on-site medical clinics, to pay for additional counselors and mental health services, to cover prevention and after-school care, and to start new programs focused on childhood trauma. Today, 80% of the schools are using these resources to invest in mental health through more than 1,300 different services. Number three, we built on our successful Ohio Start program that helps struggling families get better access to addiction and mental health treatment so that their children don't end up in foster care. To date, more than 4,000 Ohioans have benefited from the program, and half of these are children. Number four, we dramatically increased crisis stabilization services by awarding funding, $70 million, to local communities to meet their unique needs. Again, this was, as is true with all of these, we worked with the legislature on this. I want to thank them for that. In regard to this crisis stabilization money that I just mentioned, some used the money to build crisis care centers, some chose to launch mobile response units, others used it for training. The goal is for Ohioans to have access to help when they need it, and for that access to that help to be close at home. Number five, we launched a campaign to fight stigma. We did this along with the private sector. Our Recovery Ohio initiative and Nationwide Insurance partnered with the Ohio Opioid Education Alliance on the Beat the Stigma campaign to challenge how Ohioans think about addiction. Those public service announcements have been seen by 91% of Ohioans, and recently we started a new phase of that campaign focusing on mental health, and those ads are appearing now. Number six, through our Pediatric Behavioral Health Initiative, we made $84 million available. The goal is to increase accessibility to behavioral health care for children across the state by funding expansions of inpatient and outpatient care. For example, at Dayton Children's Hospital, construction is now underway on a new pediatric center for mental health, thanks to the support, again, from this initiative. Number seven, most recently, we partnered again with the General Assembly on our Wellness Workforce Initiative to tackle the shortage of behavioral health workers, and this is now just beginning. That money, $85 million, will help us reach our goal of adding 4,500 qualified specialists in the behavioral health field within the next 3 years. Let me now turn to the topic at hand, and that is social media. Last month, the Surgeon General of the United States issued a public warning saying that social media often contains, and I quote, extreme, inappropriate, and harmful content, end of quote, including content emphasizing self-harm, eating disorders, and other self-destructive behavior. It can pose a profound risk of harm to the mental health and well-being of children and adolescents. Parents, sadly, are not always aware of what their children are seeing and what they're doing online. And children are online a lot. A 2022 Pew Research Center survey found that up to 95% of teens reported using social media, and about one-third, 35%, said that they are using social media, quote, almost constantly. What kids are being exposed to can certainly be very harmful. In one recent study that was published in the Journal of the American Medical Association, that study found that teens who spent more than 3 hours a day on social media faced double the risk of experiencing poor mental health outcomes, including symptoms of depression and anxiety. Let me now turn to Tony Coder of the Ohio Suicide Prevention Foundation to tell us about some of the families that he has been working with and that his organization has been working with, and some of the research being conducted into this area. Tony, get out of your way here.
Thank you, Governor DeWine and Lieutenant Governor Husted, for this important discussion about social media's impact on youth. As the governor said, I am Tony Coder, and I'm the executive director of the Ohio Suicide Prevention Foundation. I'm grateful to be part of this conversation as we are seeing more and more research pointing to the negative impacts of excessive social media use, especially among young children and early teens. Governor DeWine talked about the U.S. Surgeon General's report, so I will reiterate that the more that a child uses, the worse health outcomes, mental health outcomes that child can experience. But even with all of the troubling research that we're hearing about social media, my work deals with individuals and families of loss who have lost a loved one, a daughter, a son to suicide. Among the many families I work with, one family came to mind as I prepared for today. This family's a good family who was involved in their children's lives. Their children had good grades. Her older son also struggled, however, with evolving mental health issues. And I texted with her this weekend asking if I could share her son's story, and she said that recently it was the anniversary of her son's suicide, and told me that this year it was harder than previous years. He was supposed to graduate high school, and years before he took his own life. The mother said, I don't know why it was tougher this year outside of that, and she was fine with me sharing her son's story, but I'm not going to be sharing names because of the difficulty that she is experiencing right now, even years after her son's death. She had told me many times that her son was an Eagle Scout, loved sports, but also struggled from being bullied, many times cyberbullying. And cyberbullying is not like when I was a kid where, if you were bullied at school, you could come home and be in your family. You're constantly around it through social media. He was struggling with why he was cyberbullied and how tough it was for him to escape, as even if he turned his phone off, his friends would tell him what was being posted online about him. She said that on the night of his suicide, he went into her bedroom before going to bed and asked if he could talk to her about some of the issues he was struggling with. They talked for a long time, and it was a school night, and she, her husband, and this boy left, she said, on a good note. He seemed to feel better. She said that even when he left, he said, "I love you, Mom, and I love you, Dad." It was Mom's birthday that day. Little did she know that he went to his room and put out on his own social media, "I'm giving anyone 30 minutes to let me know they care, and if they don't, then I'm not going to be around anymore." As this young man, just a few years into his teen experience, reached out, not one soul replied. The next morning, this young boy's younger brother discovered him in his room, a victim of suicide. This mother and I have spoken about this many times, and she has told me if I had known about this social media and could have checked, I could have talked to him about how many people did care. I could have got him into an emergency room. And now she has to live every day with the understanding that her son, even though she had spoken to him right before he left her room, reached out to the vast openness of social media, asking and begging for someone to care. And this is the impetus of this action, not to prohibit, not to censor, but instead to give parents a chance to know what's going on with their children's social media and the platforms that they're using. I was asked this weekend, why haven't parents become outraged by this and spoken out strongly against it? And I simply said, because a parent's grief is more overwhelming than a parent's outrage. They're paralyzed. And I must include this mother that I just spoke about as paralyzed and overwhelmed by grief over the loss of her child to suicide. We must help those who have no time, have no energy, and are just trying to find their kids' help so that we can be the voice for those who are struggling. And I am hopeful, and I believe that this act that Governor DeWine and Lieutenant Governor Husted are advocating for will be another way that parents can help their children navigate the very difficult trails of social media. That by knowing the social media platforms that their children are on, they can also monitor and help their child when they see them in a troubling spot on a social media platform. This is a good and right thing to do, and I know that the parents that I represent welcome and applaud this. So on behalf of the parents who have lost, and those parents who have a child or young teen who is struggling, Governor DeWine, Lieutenant Governor Husted, we are grateful. As someone who has a 14-year-old myself, I personally am grateful. Thank you for allowing me this time to share my organizational and personal support of the Social Media Parental Notification Act, and I'd like to introduce my good partner, Lori Krith.
Thank you, Tony. And thank you, Governor DeWine and Lieutenant Governor Husted, for your commitment to the health, safety, and well-being of our youth across the state of Ohio. Social media is largely seen as a place for connecting and socializing by today's youth and teens. And as any activity that can be used for good, it can also have concerns and be dangerous as well. The governor mentioned recent research, and this has made them feel left out. And another 23% say these platforms make them feel worse about their lives. Teen girls in particular report encountering some of these pressures at higher rates, but teen boys are not exempt from this, and older teens, 15 and 16-year-old males, are experiencing this as well. Social media interferes with in-person relationships, with physical activity, and with sleep. And these are all things that our youth, children, teens need to be physically and mentally healthy. According to the National Center for Excellence on Social Media and Mental Wellness, because social media platforms are driven by algorithms to maximize user engagement for profit, they can and do expose our youth to content that may not be appropriate, that can promote unhealthy social comparisons and contribute to increased depression and anxiety and social isolation. And this is just what we know about social media. There are research and knowledge gaps, things that we don't know yet, particularly around children and adolescents when it comes to social media. In addition to the work that the Lieutenant Governor is leading to hold social media companies accountable to parents, the Department of Mental Health and Addiction Services is working to convene mental health experts and teens to identify ways to address the challenges and opportunities that social media presents to our youth. This work will include engaging families, schools, and community organizations to widely share best practices that build skills needed to safely use social media. We're also leveraging our partnerships with the Prevention Action Alliance and the Ohio Youth led prevention network to develop tips for teens, children and youth, parents, families, educators, and physicians, and promote awareness of helpful resources. There are resources available now, and I'll share a couple of those examples. Nationwide Children's Hospitals has the On Our Sleeves campaign, and this website has some fantastic resources around social media use, including how-to guides on having conversations with your children, around safe social media use, protecting privacy, and minimizing risks for kids with mental health conditions who are particularly vulnerable to social media. The National Center for Excellence on Social Media and Wellbeing that I referenced earlier is also recently launched an easy-to-use question and answer portal for parents looking for advice about how to talk to their children about social media and their relationship with technology in general. It also offers resources for educators who are looking for opportunities to engage their students in classrooms and for physicians who are working to support families. Lastly, I'd like to thank the Governor and Lieutenant Governor for the bold investments that their state budget makes in evidence-based prevention and wellness strategies to help families, schools, and employers recognize warning signs of addiction and suicide, and equipping each of us in ways to intervene to save lives. It takes all of us working together to remain vigilant and make sure that help and resources are visible and accessible to families across the state of Ohio. Thank you.
Thanks, Lori and Tony and Governor, for your thoughts. I recall listening to the Governor's State of the State address. We're all sitting there, and he quoted Bishop Desmond Tutu. He said, "There comes a point when we need to stop pulling people out of the river, and we need to go upstream and find out why they're falling in." And as the governor was saying that, I was reflecting that's exactly what we're trying to do in the budget through the Social Media Parental Notification Act. Because we know that these technologies are negatively affecting our teens and adolescents from a mental and physical point of view. The evidence is clear. Talk to them. Just talk to somebody who deals with children. Talk to teachers. Talk to educators. Parents who see what's happening to teenagers in many cases. It's affecting children, and the Surgeon General even recently talked about it in his report. And actually, he was quoted as saying that he wouldn't even let his children have access to phones until they were in high school. It's leading to deaths of young people. And we know that the algorithms that are in many of these social media apps are targeting children to addict them to these platforms. That's what they do. It's designed to be addictive so that your children spend time on receiving information that is very destructive to their mental health, their physical health, their academic progress. And it's time we do something about it. And that's what we're doing with the Social Media Parental Notification Act. The social media companies use these algorithms to addict our children to these platforms, and they need to be held accountable for it. Parental permission is the key to this. We are basically saying in our bill that if you're under the age of 16, that parents must sign off on it. They must give their child permission to have access. And then, at that point, the parents will have the ability, before they sign them up, to set the filters, to limit the amount of time that children can see their social media applications, and to moderate the type of content that they want them to see, getting them engaged. None of us would think it's a good idea to allow a stranger to have a conversation in the privacy of your child's room and collect data on them. Yet that's exactly what's happening through these social media applications to our children. And since the time that we introduced this, other states have followed suit and introduced laws and passed laws limiting access. I want to thank the Ohio Senate for including the language in the latest updated language in their version of the budget. And this, when enacted, will help protect our teens. I have literally met doctors who have entire practices set up on treating children who have addictions to these platforms, who are antisocial, who's affected their lives. Something that didn't even exist in our society a decade ago. And today it's an epidemic among our teens and preteens. And this legislation will help. I also will say that it's important for parents to educate themselves on what's happening to children, to their own child. The American Psychological Association issued recommendations for adolescent social media use. I share these. These are not in the bill. There's not a requirement, but I share them to help so that you can help us educate parents on what they should do. First of all, you have to have conversations with your children. If they're on, talk to them. Have them show you the content. Have a conversation about it. Monitor how it's affecting their lives. Limit the content in hours so that they're seeing things that are age appropriate and they're not seeing it later in the evening that will affect their sleep hours or their mental state when they're trying to go to bed at night. I will tell you that I'm going to give you a recommendation as a parent of two teenage girls. Phones don't go in the rooms. They don't stay in the rooms overnight. You keep them in an area where you can monitor the use. And, you can do things like have them charge them at night in a location that you have access to, not that they have access to. These are the things that we have to do to help our kids. I spend a lot of time on technology. Technology can be a wonderful thing. In Leading Innovate Ohio, we see how technology can solve all kinds of health issues and create efficiencies and improve our lives. But this is one area where we got it wrong. We've been conducting an experiment on our children that we know is failing, and we need to act. And with the governor's leadership on a variety of children's health issues, and Director Chris and others, this is one important step that we can take to take back the lives of our children from these addictive platforms that we know are harming them. And I encourage the General Assembly to get it passed as soon as possible. Thank you very much.
Happy to take any questions.
Governor, the state of Utah has a similar law that was recently enacted that makes it, extends these limits to 18 instead of 16 and also prohibits children from being able to log on at night without parental permission. Why doesn't this proposal have those higher limits?
And we'll let the Lieutenant Governor take that. Look, Ohio really kind of led the way when Lieutenant Governor and I made this announcement that we were going to ask for this to be in the budget. We've had other states who've started looking at it. There's different ways of doing this. I don't know if there's anything magical about one particular age. You certainly could do it the way that Utah has done it. These are things that are, obviously up for public discussion. I think the most important thing is that we do something in this area. And the key to me is really putting the ball in the court of the parents and giving the power to the parents. John?
Thanks, Governor. So the last part of that about setting hours and not allowing them to log on, you can do that by setting the filters on your child's phone, which in our legislation will be part of the process for authorizing them to do it. the difference between 16 and 18, I don't know that answer, but I listened to a lot of medical officials. There was actually a column in the Wall Street Journal over the weekend that said 16 is the right age. There have been a number of social scientists, Jonathan Haidt and others, who have said 16. So based on the preponderance of the recommendations that we have seen from experts in this area, 16, under the age of 16 is where we landed.
Is there, or do you think there should be any sort of, like, what is the penalty for a company not doing this? And what kind of verification are you looking for? I guess I ask in particular, like, if there is a family where there's a divorce and there's an acrimonious custody battle, like, what kind of verification does, say, Facebook need to prove, like, that I'm the custodial parent, right? That I have the right to give this permission? Or I guess, like, and if that doesn't happen, like, or what sort of liability is there for the company?
So we have this is pretty spelled out in the legislation in terms of, and I'll pull this out here and go through it with you. Look, the companies have this responsibility to create a method to determine whether the user is a child under the age of 16, so they have to have that verification. They've got to obtain verifiable parental or legal guardian consent, so they're required to do that. Send written confirmation of consent to the parent or the legal guardian. If the user indicates they are under the age of 16, via the splash page, the following methods can be used for verification. Sign a digital form consenting to the terms of service. Use a credit card, debit card, or other online payment system. Call a toll-free telephone number. Connect to a trained personnel via video conference. Check a form of a government-issued identification. So if you're over the age of 16, you might have access to a driver's license, for example, that you could use to verify it. We have offered all of these companies the opportunity to weigh in on this to make sure that we have done it in a way in which they can comply. We have listened to all of their concerns, and those concerns are incorporated into the bill. So like any new law in a new area, I'm sure we will learn things from this, and that's why it's important that we get it in place, that we be in that process, that we start to involve parents in the decision-making process. So we've outlined it. We've given all of the companies a chance to weigh in. I will say that my belief is that they finally get that this is happening, that other states are doing it, that we're doing it, and now they're starting to engage to make sure that we're doing it in a way that they can live with.
Lieutenant Governor, Mr. Coder mentioned how this bullying happens even if the child is not on social media themselves. So if kid A's parents won't give them consent to be on social media, and everybody else at their school is bullying them while they're not there, I mean, how does this actually end up reducing that if this can still happen with or without the child's presence?
So it's the isolation that causes the problem based on the information that we've consumed on this. It's that when you're on that online world, you don't have an adult. If it's happening at school, at least you have a teacher and a principal and a student resource officer and other people there to help and trained counselors and people like that to help you. If you're in your room at night and there's no one around, you're in complete isolation. If there are no limits, the bullying can occur to you in an isolated setting 24 hours a day, 7 days a week. This is not going to solve every issue surrounding bullying in life, and we don't suggest that it will. But it's going to give parents a way to fight back against literally companies who are making billions of dollars collecting data on their children and addicting them to this platform, and sometimes they don't even know it's happening. And this is our initial effort to fight back against it. And I think it's a pretty powerful way to do it. And look, we hope to create an awareness and a movement. Look, I would encourage schools to consider policies that say, look, in the school day, particularly in junior high, we don't need phones. We don't need them there. There are lots of different ways that we can do this as a society, but this is our opening process. This is the opening way that we're fighting back parental notification. And I think it's going to have a big impact because it's going to start to engage parents at being parents in this area in a way that will help them enforce these issues and create. Look, a lot of this peer pressure is that, well, this person's doing it and this person's doing it, so I want to do it too. But if you start getting parents involved and this friend's parents talk to this friend's parents and we say, hey, no, we're going to do this together. We're going to protect our kids. It's a very powerful way to allow parents to fight back against this.
Dan DeRose with 19 News. We're going to jump in, and as this press conference wraps up, this is a bill, an act that is being put into the budget. This is a way to hold social media companies accountable. We heard it laid out a little bit there, what the wording is. Parents must sign off on anyone 16 years of age and younger to be able to get a social media account. That then gives the parents the access to set filters, time limits, and what type of content. You heard really kind of a powerful statement from the Lieutenant Governor that technology, according to the Lieutenant Governor, has been phenomenal in so many ways of our lives. But when it comes to social media, according to the Lieutenant Governor, we got it wrong. And the way it's impacting our kids' lives, we have been all over this on our solutions journalism team, our solutions team, talking about the recent suicides, some of them coming as a result of sexting, a child having a conversation with maybe not even someone in the country. They get lured into trading nude pictures, and then that person tries to either entice or get money out of them, or we're going to spread your pictures all over the place. We have seen that play out here locally, some very, very sad cases. So again, a chance for parents to fight back against these monster companies, social media companies that are making billions of dollars. As you heard the Lieutenant Governor say, they have created this platform to become addictive so that kids, parents, adults are on social media constantly. That's how they make their money. We will watch this part of the budget. This is an act or a bill that's being attached to the governor's budget, the biennium. So if it passes, and it sounds like it has support in the House, this could become a reality here in the state of Ohio. If we have any other breaking news, we'll bring it to you here on our digital properties. Our 11 o'clock news just under a half hour away on CW 43, and then of course our noon news on Channel 19. Until then, I'm Dan DeRose with 19 News Now. Have a good afternoon.
19 News is everywhere. Download our CTV apps and follow us on social media.